weeks is so exciting, halfway through. If you're 20 weeks pregnant, I hope you're excited because you are officially halfway through your pregnancy. You are 20 weeks now, and you have 20 weeks more to go. That is so exciting. Congratulations, you're doing so well. If you're watching this video, you probably have a lot of questions like, what is this big ultrasound coming up? What are they looking for? What tests am I going to expect in the next few weeks? When do I start seeing my doctor more often? When am I going to start feeling the baby move more? We're going to talk about all of that right now. But first, if you're new here, you're watching In the Health and Medical Zone. And if you're new here, In the Health and Medical Zone means being in good health and spirit. So, if you like being healthy and happy, click subscribe, because you're in the right place. 20 weeks is a huge milestone. You're officially halfway through the pregnancy. Your baby is around 6.5 inches long and weighs about 10 ounces. Your uterus should now be up to the level of your belly button, and you can definitely feel your uterus at this point. I talked about this in my earlier videos, week 9 or 10, I think. But you can push on your symphysis bone and keep pushing up until you feel that drop-off where your tummy gets soft. That drop-off is the top of your uterus, and at this stage, it should be right at the level of your belly button. You may have noticed that your OB measures your tummy each time you go in for your appointments. They're measuring your fundal height. In other words, they're measuring from the pubic bone to the top of your uterus. This is one way they can tell that everything is growing the way it should. And it's pretty cool because your fundal height measurement in centimeters is usually the same number as the number of weeks you are, give or take a centimeter or two. So right now, you're 20 weeks along, and your fundal height should be somewhere around 20 centimeters. I've always thought that was kind of convenient. However, with your growing tummy, you're going to be experiencing some aches and pains thanks to a hormone called relaxin, which your body makes when you're pregnant to help loosen the ligaments for delivery. Because of this, you might be noticing some achiness in your back, hips, and pelvis. Some women choose to get a maternity belt. This is a supportive belt that wraps around your belly and hips. Some offer even more support by wrapping around your shoulders and down around your thighs. There are tons of different options, and it really depends on what you're looking for and where you want the support. Another helpful thing for those aches and pains is trying Epsom salt baths. Epsom salt baths are really soothing for your aching back, hips, and feet as well. As for your baby, they are starting to work on their suction motions. And if their thumb gets near their mouth, they might start sucking on it. Their genitalia are more fully formed now. And if you're having a girl, her uterus is fully formed and her vagina is forming. She already has ovaries that contain around 7 million primitive eggs. And that number actually drops to around 2 million by the time she's born. Now, if you're having a boy, the testicles are already formed, but they're still up in the abdomen. Eventually, most of the time they will descend into the scrotum before the baby is born. Speaking of gender, many offices do your big ultrasound around 20 weeks. Some people call it the target ultrasound. Some call it the comprehensive ultrasound. It can also be called the level 2 ultrasound or the anatomy scan. But what it really is, a very detailed ultrasound done by either an ultrasonographer or sometimes your OB. This is a much more detailed scan than the regular ultrasounds you've been getting before. Your OB is gathering a lot more detailed information about the baby's brain, lungs, heart, liver, kidneys, and bladder. They can look for different girth defects like cleft palate. They can see spina bifida. And they are also looking for signs of Down syndrome. This is also when your baby's gender can be confirmed most of the time. As for you, by this time, most women have started to feel the baby move. We call this quickening. This can feel like butterflies in your tummy, or maybe like a little gas bubble. But as the weeks go by, these movements will get stronger and much more recognizable. You'll also feel movements a lot more frequently. If you're not really sure if you felt the baby move yet, don't worry, that doesn't mean anything is wrong. You're going to feel it soon. In the next week or two, almost everyone does, usually by week 22. Now, you might also be feeling some other symptoms that aren't so fun. Some common problems women experience in the second trimester include headaches, heartburn, low back pain, which we talked a little about, round ligament pain, leg or ankle swelling, and leg cramps. These are common issues, and you should make sure to talk to your OB about them. I've talked about each of these in some of my earlier week-by-week pregnancy videos. So if you're joining me for the first time, I highly recommend checking out some of my earlier second trimester videos. I cover a ton of really good information that can help you through your pregnancy. Thank you for watching.